Now, on May 25th, the nation will vote on whether to remove or retain Article 43.3 of the Constitution, which guarantees the right to life of the unborn. Over the coming weeks, we'll be looking at several of the central issues involved in the debate. Tonight, we look at one of those issues. Does the Eighth Amendment put women's lives at risk? Conor Wilson reports.
The Eighth Amendment guarantees the right to life of the unborn. But what about the woman carrying that unborn child? Could the Eighth Amendment prevent appropriate treatment taking place? In vindicating the right to life of the unborn, is there potential for the lives of women to be put at risk?
Medicine is a science. It's not a religion, it's not a philosophy, and it's not an ideology.
In a difficult clinical situation or a situation of risk, the Eighth Amendment has never been in my mind in terms of making clinical decisions.
While the Eighth Amendment may have effectively outlawed abortion, the landmark X case ruling in 1992 found that a 14-year-old girl had a right to a termination, as the pregnancy caused by a statutory rape had put her life at risk through suicide. The ruling eventually compelled the Oireachtas to outline in legislation the circumstances in which an abortion could be permitted.
The Protection of Life During Pregnancy Act 2013 was enacted to try to give effect to the decision of the Supreme Court in the X case. One of the features of modern abortion law in Ireland is that the courts have gone first and the legislation has had to follow. So in the X case, the Supreme Court came up with a legal test, which is there has to be a real and substantive risk to the life of the mother, and the Oireachtas then had to pass legislation to try to give effect to that legal test.
Irish law currently allows for pregnancies to be terminated when there is a real and substantial risk to the life of the mother, either through physical illness or suicide, and when that risk can only be averted through a termination being provided. But what is a real and substantial risk? And when does a risk to health cross the line and become a risk to life?
But the difficulty we have is qualifying what is a substantial risk to life. You know, is it a 10% risk? And I say this very often, is it a 20% risk, a 50% risk? And what of the woman herself? What is her view of what is an acceptable risk? What are we telling women and what are we saying to our patients? We are saying you must be dying before we will intervene. There's no other area of medicine in which doctors are required to practice in this way and with this sort of consideration.
A real and substantial risk is a matter of clinical judgment. In my opinion as an obstetrician, the 2013 Act did clarify some matters for clinicians in the care of women where their lives may be endangered. And the Medical Council guidelines, which followed on that and have been in place for many years, specify that if a woman's life is at risk, that risk does not have to be immediate or it does not have to be inevitable. So a doctor has the flexibility to act and does not have to wait until the woman, as has been claimed, is at the point of death before intervening to offer effective treatment for a mother.
Even with the Eighth Amendment, abortions can be carried out in Ireland once the conditions outlined in legislation have been met. But do the legal consequences for doctors cause them to hesitate? Does the Eighth Amendment bring with it a chilling effect, where appropriate treatment could be delayed in a situation where any delay could have very serious consequences?
This concept of a chilling effect was mentioned in the case, the European Court of Human Rights case, ABC versus Ireland. And in that context, the court talked about the fact that there were uncertainties in Irish law in relation to this meaning of real and substantial risk, and that in light of that and the fact that there were criminal prohibitions on abortion, which were subject to a sanction of potentially 14 years in prison, that this led to this chilling effect which might affect the way doctors manage a particular case. There are still uncertainties in the law around the meaning of real and substantial risk. It is true to say that there have not been any criminal prosecutions, and to the best of my knowledge, no complaints to the Medical Council in relation to a doctor who has provided a termination of pregnancy in these circumstances to date.
In October 2012, Savita Halappanavar was admitted to University Hospital Galway with lower back pain. She was 17 weeks pregnant. After being told she was miscarrying, Mrs. Halappanavar requested a termination, which was refused. She developed an infection which triggered sepsis. That sepsis progressed to severe sepsis, eventually leaving her body in septic shock, which brought on a cardiac arrest that killed her. 3 separate reports found fault with hospital staff's failure to identify, adequately monitor and treat sepsis. The HSE report identified non-adherence to clinical guidelines related to the prompt and effective management of sepsis, severe sepsis and septic shock when it was diagnosed as a key causal factor in Mrs. Halapanavar's death. The HSE report also recommended that the Oireachtas consider the law, including any necessary constitutional change for cases like this.
The chairperson of that investigation indicated quite strongly that, in his opinion, the presence of the Eighth Amendment was a contributing factor in the sense that all of the options for managing her condition were not available, given that there was a fetal heartbeat.
In its examination of other key causal factors, the report stated, the investigation team is satisfied that concerns about the law, whether clear or not, impacted on the exercise of clinical professional judgment. And the consultant clearly thought that the risk to the mother had not crossed the point where termination was allowable in Irish law on the morning ward round on the 24th.
So I think the most we can say is that it played a part. It wasn't necessarily the main cause of her death, because of course we know that she died from sepsis, but it was a contributing factor because another option, which is to terminate the pregnancy at an earlier stage, might have been available to her if the Eighth Amendment did not exist.
Well, I've been working as a consultant obstetrician for 30 years under the Eighth Amendment, and in the hospitals where I worked we delivered about 50,000 mothers without any death, and that's not unique. So I think the first thing I would say is that the idea that the Eighth Amendment is dangerous for mothers is not sound. This is not primarily a medical issue. It's about the question of whether the unborn child has rights or not. We now know that if the amendment is removed, the unborn child will have no rights.
Do we really require a list of names of dead women in this country to determine how we care for women in pregnancy that is complicated by serious disease and complicated by serious complication? It also ignores the fact that we have termination of pregnancy in Ireland. Approximately 4,000 to 5,000 women, we estimate, access termination of pregnancy every year in this country. They access it in the UK, or they take tablets which they access via the internet. I think the Eighth Amendment should be removed from the Constitution because I believe it creates unacceptable clinical risk for women in Ireland today.
Legislation can be changed or done away with entirely over time, but while the Eighth Amendment remains in the Constitution, will there also remain the chance that cases like Savita Halapanavar's could happen again?
It's clear that there are doctors out there, eminent doctors, who believe that the current wording in the Constitution has unnecessarily endangered women's lives. On the other hand, there are doctors who strongly disagree with that, and it's hard to provide a legal answer as to who is right. Safe to say that no matter what test is in the Constitution, doctors are always going to have to make difficult decisions. Doctors may disagree, and in those cases, their ultimate resort is to the courts.
Barrister Paul Anthony McDermott ending that report by Conor Wilson. I'm joined now by Dr. Eamonn McGuiness, former chairman of the Institute of Obstetricians and Gynecologists and medical advisor to the Save the Eighth campaign, and by Professor Mary Higgins, consultant obstetrician and specialist in high-risk maternal medicine, who's a supporter of Together for Yes. Eamonn McGuiness, obviously time matters in clinical decisions. Hours matter, sometimes minutes matter. Surely a doctor should be able, in consultation with a patient, to decide what's the best treatment for that patient without having to wonder, does the threat to her life qualify as real and substantial?
Well, David, I've been 40 years plus in obstetrics and gynecology. I have never been confronted with a situation that I couldn't determine the risk to the patient. And I have done 4 terminations in my career for gynecological cancers, in which case the pregnant uterus was removed. The baby had no hope of survival because it was only in the first or early second trimester. I never had any difficulty in making that decision, and that decision would be in conjunction sometimes with a radiotherapist or an oncologist. I'm not including obstetric reasons for early delivery. They're well known, and there's a lot of emergency obstetric cases that are dealt with, and I have dealt with them. Never had any difficulty. I never felt under any threat. I never felt the Eighth Amendment inhibited me in any shape or form.
But The law is there for a purpose. There are penalties on doctors who breach the law. Doctors have to have that in the back of their mind, and surely there must be some situations where treatment is delayed.
No, there's no situation where treatment is delayed. I have never thought secondly about it in conjunction with the patient and discussing the patient, discuss with the patient, put the facts before them and make the decision as to what was the right and proper treatment for the patient.
In your experience, has any woman died in this country because of the 8th Amendment?
No patient has died. And we have a confidential inquiry in this country and there's none listed. And some of the information we get is quite ridiculous out there because, I mean, Professor Louise Kenny has said that there are many patients dead. If these patients are dead, they must be in the confidential inquiry,
Okay.
and they're not.
OK. Mary Higgins, Eamonn McGuiness claims that no woman has died in this country because of the 8th Amendment.
That's not true. It's well recognised that Savita Halappanavar, Mrs Halappanavar, that the 8th Amendment was a contributing factor to her death. On the news today, there's another woman who died as a result of abortion care that she couldn't avail of in Ireland, so she died in the UK. We were aware of these cases, and we were aware of the second lady, and it's good that this is coming out to the fore so people are aware of it. I am a high-risk specialist in Holles Street. I work in a tertiary level centre. I'm looking after women who've got complex medical problems, healthy women who develop complex problems in pregnancy, and women whose babies have problems. And I can tell you it absolutely affects how I do my care. I'm looking after women with cancers. I'm looking after women with diabetes. The real and substantial risk is very difficult to quantify, and Dr. Mahoney illustrated that. We do not know what it actually means. We have to wait until women have an infection, until they're bleeding. We have to wait, and then we have to think about doing an operation, doing a procedure that could further increase our risk.
Both Mrs Halappanavar and the lady who the inquest was into, Ms Chatera, both of those cases happened in 2012. Since then, we've had the Protection of Life During Pregnancy Act, which has and new guidelines from the Medical Council, which many people would argue have clarified the situation, and that neither of those situations would occur now. I
would disagree. Mrs Halappanavar died of rupture of membranes. We would have women coming in still who've ruptured of membranes at 17 weeks, many of whom will ask to us, is the same thing going to happen to me as happened to Savita Halappanavar? They will turn to us and say, what criteria can you say that I will intervene? We will say, look, the risk of your baby surviving is very low, and they will be devastated by that. The risk of you having a complication is very high. And they will ask us, at what point will my temperature be high enough? At what point will my pulse be high enough?
And what's the answer?
We have to wait until they actually have frank signs of chorioamnionitis. We have to wait until they're actually sick enough that we can turn to them and say, OK, now we can intervene. Now we have justification. OK, I want to bring Eamonn back in again, but before I do, if the 8th Amendment was causing the problems that you believe that it is, surely our statistics would show that, because the statistics seem to show that Ireland is a very safe place to have a baby in. Mortality shouldn't be the lowest thing. We look at morbidity as well. We have women who have health issues in pregnancy. We've only had 25 women a year who've availed of the protection, who have met the criteria for the Protection of Life Act. 3 of those have been under Section 9, which is risk of suicide. But we're looking after women. I mean, I'll be doing a clinic in Holles Street tomorrow, and I'll be doing another one on Friday, and I'll be doing another, I'll be on call, and I will be looking after someone and saying, I cannot provide the care that I could provide to you in another jurisdiction, and they will travel, or they will take illegal medications, or I will look after someone at 3 o'clock in the morning who'll come in bleeding, and I will wonder whether she's had a complication. OK, Eamonn McGuiness, the Savita Halappanavar case, her death was caused by the mismanagement of sepsis. That's,
yes,
I think, established.
That's accepted.
But she wouldn't have had sepsis if she'd had a termination when she asked for one.
I think everybody accepts that she was mismanaged and that her uterus should have been evacuated. I think that the clinicians in the particular case weren't aware of the severity of her illness.
And they also, according to the independent inquiry, there was nervousness on the part of the doctors as to what they could do, and that's the chilling effect that people talk about in action.
I don't think there's any difficulty in managing that case. That case, every colleague I spoke to would have managed that case completely differently.
And yet the independent investigation says the investigation team is satisfied that concerns about the law, whether clear or not, impacted on the exercise of clinical professional judgment. So the independent inquiry is saying that an element of the mismanagement was fear of the law.
I don't accept that.
You don't accept the independent inquiry?
I don't accept the fact that the law restricted the management of that patient.
OK. Mary Higgins, we heard
Dr. Monaghan there in the report say that the risk to life limitation isn't restrictive because the Medical Council guidelines now say the risk doesn't have to be immediate and doesn't have to be inevitable. The clinician assesses the risk, so there is flexibility to act.
John Monaghan is someone I would respect, but he represents a different point of view to the vast majority of people working in obstetrics in Ireland at the moment. The chair of the Institute, the chair alert of the Institute are all advocating for a yes vote. 81% of the Institute of Obs and Gynae support repeal. People are coming out every day who are saying the status quo is not working. People I respect, people I've worked with, people who know what it's like. These, and the one thing I have to say that's been fantastic about this entire debate is that we're hearing stories that we would have heard in private, but now people are coming out, so the greater population are aware of these stories. So I would say that there is a massive effect to our care of patients, of women, of families, of couples, because it's not just about the woman, it's about her husband. It's about me trying to explain to her mother that she's not sick enough, even though she's in ICU, that I can't intervene yet. OK.
Eamonn McGuiness, you wrote in the Irish Times about the Medical Council guidelines. You wrote, in plain English, it means if a doctor feels a pregnancy poses a real threat to a woman's life, even if that threat is not immediate, they may perform a termination. Does that cover the case of a woman with a heart condition that a cardiologist will say the strain of pregnancy will shorten her life? She might live for 30 years instead of 40 years. Does that cover that?
It does. If the cardiologist considers that the patient should have a termination carried out, then the patient should have. And I have looked after complex cardiac cases because I worked in Bagot Street and I worked in St James's Hospital. So I had exposure to that. When I was in Cork, I looked after diabetics. So I've seen complex obstetric cases.
And they get the terminations?
They would get a termination if the cardiologist advised it, or a respiratory physician. I'm only an obstetrician just like Mary is. I'm not a specialist in cardiology and I'm not a specialist in respiratory medicine, so I have to take a colleague's advice. If the colleague says this patient should be terminated, then I would terminate the pregnancy, and the 8th Amendment would not restrict me.
Is that your experience?
I'm not just an obstetrician, I'm a maternal medicine specialist as well. I would always ask the advice of others, and I would not agree with that in any way. Okay. It's not my experience. It won't be my experience tomorrow or Friday in clinic.
OK, Mary Higgins, Eamonn McGuiness, thank you both for joining us. And we will be returning to this issue during the rest of the campaign. Miriam.
That's it from us for tonight. And just to remind you of that number for cervical check, if you're concerned at all about the issues we were discussing earlier, the contact number is 1800 454555. That's every day, 9 a.m. to 6 p.m. For now, though, from Dave and myself, everyone on the Primetime team, thank you very much for watching, and Ihawa.
And tomorrow night we've the first of a 3-part series which follows 3 Irish people living off the land who travel to sub-Saharan Africa to advise those eking out an existence there. Don't miss The Hardest Harvest Wednesday night at 9:35.